Hello, welcome to this e-learning session. I'm Priya Sabnis, Assistant Professor from PSC College of Arts and Science. In the earlier session, I have already discussed with suicide clinical picture and causal pattern. Now in this session, I will be presenting module number 21, that is suicide prevention, which is again from the same unit 2, disorder of anxiety and mood. Now in this session, what I'm going to discuss here, first I'll briefly discuss about suicide ambivalence, communication of suicide intent, suicide notes, and then our main topic, that is suicide prevention and intervention, under which I'll discuss treatment of mental disorder, crisis intervention, focus on high-risk group and other majors. At the end of the session, what you're going to learn and understand is the meaning of suicide ambivalence, examine communication of suicide intent and suicide notes, analyze the goals of suicide intervention, examine the ways currently used to prevent and treat suicidal behaviors. Now coming to suicidal ambivalence. Ambivalence often accompanies thoughts of suicide. That is, some people do not really wish to die but intend to communicate to others concerning their distress. Then there are small minority of suicidal people on the other hand who intend on dying, whereas a third subset of people are ambivalent about dying and usually leave the question of death to fate. Now when this ambivalence is there, it may lead to unsuccessful attempt. And this unsuccessful attempt initially may lead to marked reduction in emotional turmoil, but it is generally unstable. Then communication of suicide intent. Studies conducted around the world that involve interviewing friends and relatives of people who had committed suicide has revealed that more than 40% of people who had committed suicide had communicated their suicide intent, whereas 30% had talked about death and dying in months preceding their suicide, and for most, suicide came as a surprise. The study also revealed that most of the communications of intent were to friends and not to the mental health professionals. Now here we have to understand one thing, that is, usually when a clinician knows that someone has been suicidal, he or she should not take patient's denial of suicidal intent as necessarily being valid. Coming to suicide notes. Suicide notes is an effort to understand the motives and feelings of people who take their own lives. Studies of completed suicide have found that only 15 to 25% of people had left notes, usually addressed to friends or relatives. Notes were either mailed or found on the person's body or near the suicide scene. Some notes included statement of love and concern. Occasionally, notes contained were very hostile content. Whatever it may be, notes do not usually express deep and tragic emotions. Rather, many notes are short and straightforward. Now coming to the important part, that is suicide prevention and intervention. There are three main thrusts of preventive efforts. First, treatment of persons' current mental disorders, crisis intervention, and working with high-risk group. First, we will try and understand treatment of mental disorders. As we know that people who are at the risk for suicide are the ones who are suffering from certain psychological disorders. For depression, antidepressant medication or lithium is used. Lithium seems to be powerful anti-suicide agent for long term, wherein benzodiazepines are found to be useful to treat severe anxiety and panic that often precede suicide. Cognitive behavioral therapy is found to be beneficial in reducing succeeding attempts of suicide, and it is also found to be feasible for use with adolescents who have attempted suicide. Coming to crisis intervention, primary objective is to help a person cope with an immediate life crisis. There are suicide prevention centers, and these suicide prevention centers usually emphasize on maintaining supportive and highly directive contact with the person over a short period of time, helping the person to understand better ways of dealing with the life problems, helping the person to understand that the present distress and emotional turmoil will not be endless. Suicide hotline numbers are established since 1960s for these suicide prevention centers. The staff of hotline numbers tries to show empathy, convince the person not to attempt suicide, and helps to mobilize support from family and friends. Then we come to the last one, that is focus on high risk group and other majors. Broad based programs are initiated for people who are at high risk for suicide. One such program involves older men, a high risk group in social and interpersonal activities that help others. Participating in such activities may help these older men in order to lessen up the sense of loneliness and meaninglessness which usually occurs due to forced retirement, financial problems, death of loved ones, impaired physical health, and feeling unwanted. Other programs are also targeted at young adolescents who are at high risk because of previous suicidal behavior or mood or substance use disorder. Thank you.